you'd never seen this like you didn't do the first part. So we've got our upper trapezius here, coming up into here. So the first one we looked at in the first section was one that radiates pain up into the temporal headaches. Sort of radiates pain at the base here. And so if you've got someone with pain at the base of their neck here, could be coming from this first one. So if we're just working this, we can pick up this muscle, and it's right at where the neck joins, so whether the curve here at the angle, okay? And that's him there, all right? Right and about there. So what we can do is pick him up. Now I might do a distraction technique with my other hand, as I'm just gently working that, waiting for it to let go, or you can just hold it for 20-30 seconds. You can also, just as I said at the very start of the course, just getting feedback from your client and just work it like that. Okay? And then we come along to the second one, which is the one right between the spinous C7 and the point of the shoulder, midway, right on top of that muscle, and that's it there. Okay? So the same thing. So we could, as you're massaging, you come around, do that first one, pick him up, and so you can do a distraction technique with what's known as the mother hand. Just give the nervous system different input. Do some more kneading, come to the next one. So someone's got stiff neck, pain at the base of the head. This one as well. This is your trigger point 2 of the trapezius. So, now, I could also treat this by coming around this way and picking it up like that. But I really prefer to stay on this side. As you can see, it's really easy to pick it up at the angle of the neck there. Okay, and you could even bring right along. Of course, you'll do both sides. And the other third one, which can produce pain up through here, is right down here, just off the inferior angle of the shoulder blade, the scapula. Okay, now if you were to come across, you can see that muscle twanging underneath. That's the trapezius coming down to T12, okay? So, and it's just off the shoulder blade here. So what you can do, you can sort of just stabilize this to find that band. So what I'm saying by stabilize it, you can just find it. You can just get your finger to hold it there in place, and you can work it with your fingers, and there it is there. I can feel it right there. And if you look at your charts, you can see this one can refer pain up through here. And a lot of satellite points will release from this one. This is a major point here as well. You can also, of course, use your thumb. You see, if I don't do that, it's going to wobble all over the place. It's going to be very hard. So that's why I just kind of lock it in a little bit. You come along the border of it. If you lose it, just come back there. Now, of course, you can use your fists to iron it out even more. And of course your elbow, your forearm. Well, you could use your elbow. Of course you can use your forearm. And of course you could use your thumbs as well. You find that spot. I'll find him again. And you could use your double thumbs. There it is there. So of course you could double thumbs as well. using the techniques that I've shown you. Okay, so as you're massaging, if someone had specific pain up through here, I'm going to work that. So you're giving these areas more concentration. Person's got temporal headaches, we're going to come in. And I say you can use your other hand. There's a little distraction technique. So this is at the angle. It's coming here, where the neck, where the. I talk about this. We find this in the first section. If you haven't done that, it's clearer. But that's it. Your trapezius. Pick him up. Number 1. Number 2 is the big one right in the middle. When people press their thumbs down like that. And of course you could do that as well, but I find it's much more powerful if you get it there. And as I say, you can just hold it until you feel a release if you've got good skills, like that as well, or rubbing along it as well. Okay, and of course you do both sides. And also, don't forget to go right up to where the fascia joins the suboccipitals, or the occipital bone. If this is an area which basically everyone is tight with their upper back and shoulders anyway. So you can experiment with that. You could do bilateral if you've got enough skill, doing both sides at the same time. Okay. You can get at this is to come underneath the trapezius. Okay, so you duck underneath it, and you can come in and get that in like that as well. Okay. Right, so I'll just show you. So there's the angle there. So you can come up and under and sink in. As you go in underneath it, you're going to have short fingernails as you do that. Okay, so the next one's slightly above it. All right, and what you could do now, if you were to follow it, you feel it's around about this C4 area, C5. So once again, you can just come in. So there's the number 1 down there. You come up underneath, and it will feel like ropey bands, almost like a bone. And you work that. Now, while you're in here, you can just go slightly, if you can go underneath and keep tucking in, so you got the first one there, come up and over that, and you'll get splenius cervicus, okay, which is around T2. So you're pressing in towards the spine, so you also get that at the same time. Is that okay, Liam? Yep. All right, so just to repeat that. So we're doing a massage, and just got my fingers on it here now. That's trigger point 1. Double fingers if you want to, double thumbs, whatever takes your fancy. You do that, you can come underneath it and hit it that way. And then the next one is slightly up, so you can just follow that. And you can come underneath the trapezius or go onto it, but underneath, and there it is, I'm bang on it there. Because you can feel those sort of ropey cables. Just got to be gentle with the person because it's deep. As you can feel that. Okay. And that is a really, really important muscle. So if that person had neck pain at the base of the skull, these sorts of things, you work longitudinally and just work those bands, and I can feel that. You don't want to be too twangy if you're doing a little bit of cross fiber, but again, as I say, when I first started, I'd do a lot of cross fiber and just leave the person sore, and I later on just realised it really was unnecessary. So that's how you treat it prone. You can also treat it supine as well. Okay, so the other way you can get at it is you can come down and feel that corner of the shoulder blade there, the angle of the shoulder blade, and just press up onto it. That's the first one. Come up a little bit. It's actually easier to palpate in this position. And there's the second one in there. Okay. So that one's there. And I can feel that's really tight on Liam. Tight on a lot of people. So the first one's down there. You can also come in like we did before. This will give you a better angle. So come in. Just try and get it better for the camera. I'll go in with my fingers. Okay. So here's the trapezius. We'll come in. And you see that, I hope. And that's the first one down there. And there's our second one. It's about that much further up, about an inch. And there it is, right there. Okay, so if you've got a person with neck pain, do them both. Okay, prone, as I say, don't overwork them, but you can give them some love on these trigger points. There it is there, I can feel him. And they come up, and there is that second one right there. And so do it prone, and then when you got them supine, on face up, you do them face up as well. That can really affect neck muscles and lots of different things. So I really want to just work it. Something along those lines, okay? So you can see here, so if you want to see it, get it to pop, you get the person's head turned off to the other side. Liam, just lift your head towards the ceiling, please, love. That's it, just hold like that. So there it is, you can see it coming up here, the sternal and the clavicle branch. You can see them beautifully coming up to the mastoid, sternocleidomastoid. Good point, thank you, darling. So what you can do is, now, what I said this earlier on in the course, you never want to be massaging a pulse. So you've got this carotid artery, so you've got to be very careful when you're doing this. So if you feel a pulse, then you want to get off it. You want to come more laterally. Okay? So what you want to do here, so it's a nice way you can sort of use this hand like this, and if you just, now if you lose it, you can get the person, just lift your head towards the ceiling again. That's it. So if you lose it, so we're going to come back into here. Okay, thank you, love. And you can just pick it up. So I like to get my finger like this. And Liam, just let me know if anything's too much, okay? So now again, you can kind of do a milking technique, and you've got to be careful. You don't want to twang off it. But, and again, remember, if you're feeling a pulse up in here, then you've got to come back posterior. But if you just pick up here, you've got to try and get right up here, and there are trigger points along here, mainly through up here. Worry about ones down here can reflect to the chest. But these are the major ones we're really looking at. So we want to work along this muscle. So I like to come around, get underneath it, and then I can pick it nicely like that. You see? So I come underneath it. Again, if you are unsure, just lift your head again. Nope, that's it. Thanks, darling. If you're unsure, there it is. Put your head like that. So you can milk it, and just relax your head again. Thanks. So you can sort of milk it like this gently and work your way along it. It's a really important one to do. Trying to get it along there. Or what you can just do is just hold it and feel for a release, okay? Now, as I said to you, a sternocleidomastoid muscle, if there are no trigger points in it, it won't be sore, but it's very commonly affected. So you can just see what I'm doing here. Again, getting feedback from your client. But as you'll see in your notes, this muscle can be affecting so many different things. Is that okay? Okay, so that's the sternocleidomastoid. Okay, the temporalis. Now, to show you here, so there are 4 trigger points. Now, the way to find it, I showed you in the self-treatment area. Liam, just open and close your jaw, please, like you're chewing. That's it. So you can feel the muscles. They're connected down to the lower jaw, underneath the zygomatic arch. That's it. Thanks, Si. And you can feel the temporalis moving as you do that. So you can feel this. Now, you've got 4 trigger points here. So your bands of muscle are coming across here. So you can just go across like this and just sort of feel for tight bands as you go. Now, this can produce pain, temporal pain and a headache. Okay, it can also be across the top of the eye, and also sensitivity to the top teeth and top gums. So people come to go to the dentist, there's nothing wrong, but it's trigger points up in this temporalis. So very easy to treat, just like you would in any other muscle. You're just working around. Remember, if you look at the diagrams, the temporalis kind of comes with fans around like this. So the front trigger point goes more to the front teeth, and then we come back to the next sort of couple of teeth going back. So the further back the trigger points, the further back along the front row of the teeth. Okay, so you just feel one there. So tight. So because it's very thin muscle, it's pretty easy to find them. But so if you've got someone with those temporal headaches or frontal headaches, you want to address the temporalis as well. They can also produce a bit of pain back of the jaw here as well, so TMJ problems as well. Okay, so in a massage, you can do both sides, of course, and just work them. As I say, you look at the diagram and see where the muscles fan, and then you just go across them and work them accordingly. Okay, so the masseter, you can feel that once again. Just do that chewing movement again, please, love. Okay, so there can be trigger points all through this masseter muscle. Now this muscle, of course, can affect, so again, you've got the fibers running along here, so you go across them until you feel like right there. I can feel one. So these upper ones can produce bags under the eyes, eye problems, sinus problems from the masseter, these upper ones here, ear problems, frontal headaches, and of course, as I say, jaw problems, teeth sensitivity. There's a whole lot going on with the masseter. So you see in the diagram, so we get the ones down here, down this bottom of the jawline here. And so this is effective for people that talk, well, like someone like me who talks a lot, but singers, and there's been there's people that sing supposedly can hit their high notes again more easily when you release these. It helps with releasing vocal cords. So yeah, the masseter has got a lot going on. So you can feel this, as I say, you can feel off the edge here. So what you want to do with this one is really just work all around it. And as I say, going across like that, I can feel a really tight fiber here. So of course, people with clenching their jaws will have lots of troubles with this muscle. So just feel that through there. Feel those fibers going along here. Again, you can see in the diagram that the masseter is involved with a lot going on with the face. So if someone comes to you with certain problems with the face, you want to start thinking masseter and, of course, the temporalis as well. But most definitely the masseter. Is to make it easier, because trying to palpate these deep posterior muscles is not only impossible. We've got 4 different levels of muscles here, and there's lots of them all back in through here. So, but what we can do is just work for the tight bands, because a lot of them have got very similar patterns, but to try and find trigger points on certain deep muscles, as I say, it's really difficult through all these levels of muscle. So what I suggest is that, I mean, certain things we can do, okay? So, okay, we know where the suboccipitals are. All right, so we can work, and we've got them out through here. So you want to work from your mastoid. And again, you can look at your referral patterns here. They can refer out through here, headaches. And you'll feel these tight bands. So when you were doing your neck work, go through your massage, so depending on what the person's symptoms are, but get a better hold through the head here. So as I said to you when we did this before, we did a lateral and turn to the side there. So if we bring it, so I'm just working, so I've got the transverse process, I'm just working, so the transverse process here, so your middle scalenes here, you can feel those transverse processes, and we're just going posterior to those, and so I'm just working along them. So what I suggest you do is start off with the head in a central position, and we can just do presses. Again, you're looking, I said to you before that if you use like circular movements, you'll feel these tight bands. Okay, now, like Sadie, unless you're really hot with your anatomy and your palpation skills to know which ones are which. But it doesn't matter, because all in this area are all these muscles anyway with their trigger points. So you go around and I can feel right there's a point. So by doing circular motions, so you go along lengthways, and then because they're coming up along here, right? Circular motions, feel for those tight bands, and then like there, and then you can press on that. And of course, if you are treating someone for a specific problem, then you could let them, say to them, let me know if any of these reproduces your pain. So then you'll know which trigger point it was. So up in here. So same thing with the suboccipitals. We've got suboccipitals going on this way. Again, look at your anatomy, and up through here. So again, by working in circles, and there's another one there. So you're just scanning. So when you're doing this, you want to give the person a bit of a rest, right? So don't just continually go through here, and just keep working that. You intersperse it with some nice effleurage strokes, and then you go back doing your trigger point release work. So as we go all the way down, and make sure you come right down where we did the trigger point for splenius cervicus, right down by the levator scapulae down here. So that was that deep one, right where's your trapezius, down into here. So you really want to, don't forget right down at the base C7, C6 as you work all these. And likewise, don't forget there are trigger points up on the back of the suboccipitals and up onto the skull, the base of the skull here as well. And remember, the fascia continues all the way up here. So you want to do that. Now, what I was saying to you before is then what you can do, just relax there, bub. Oh, my son's going to sleep again on me. So you can see that's very comfortable if your client's sleeping whilst I'm pressing on trigger points. So you can keep working this in a lengthened state. So we started off here, it's more shortened, and you can do it per stroke. This is more of a release technique. And like I showed you before, is you can, like we did with the self-treatment, bring it across and turn, which gives you better access. So what we're in front of that trapezius. Okay, we're anterior to the trapezius. but we're posterior to the transverse processes, like I said, in the self-treatment area. As we work there, and I say you can just bring them to a more lengthened state. And now you've got to be a bit more careful because they're more on a stretch, but you can certainly feel those tight muscles in there. And work those suboccipitals, pressing, base of the skull, and as I said to you, just remember, mix it up with some nice effleurage as you work them. And of course, one thing I really like to do here is, I'll just show you like here, like this, in this position, both hands. And there's one there, I can feel right there. Really tight band. All right, so that's the way I address the trigger points in the posterior, and you're going to get them. You will feel those tight bands, and as I say, so that way you don't have to think about all these deep posterior muscles of the neck, and which was which, and this sort of thing. It's just to simplify it, because as I say, you feel the tight muscles, just like we've done all throughout the course. Feel those tight muscles, and then find those sensitive spots there as you'll feel. Or get feedback from your client. If you can't feel, just say, where's that sensitive? Can you feel? Tell me when I'm on a really sensitive spot. But otherwise, you can feel them very, very simply. So now we're going to do the scalenes. Now the scalenes are really commonly overlooked, and they are involved in so much. So we've got anterior, middle, and posterior scalenes here, okay? So they're actually underneath the sternocleidomastoid here, the anterior portion, and then they're right back, even behind, or sorry, in front of the trapezius. So they're all through here, okay? So Liam, just lift your head a little bit so you can see the sternocleidomastoid. Right, and thank you, love, thank you. And so what you're going to do is sort of push that away a little bit. Is that okay for you? Yep. So you just push that away to get the anterior portion. Now, these ones through here can refer pain into the chest, can be the front of the shoulder here. As you see the pain referral patterns down the arm, there can be tingling and numbness with this because there's a neurovascular bundle going down through here. So you've got to be very, very careful as you work through these, okay? Now, one thing you really want to be aware of, the scalenes can also produce pain back in the rhomboids area between the shoulder blades, and it's very often missed. As I said earlier on in the course, I missed it myself. In my lecture, do as I say, not as I do. So, right, so what you want to do here, so we've got your sternocleidomastoid, so we're really working this area through here, all right? So in front of the trapezius, so you can push the trapezius out of the way. So if you were massaging someone, and they've got, say, pain in the back of the, so you worked all the rhomboids, let's say the ones behind the shoulder blades. So again, as I said, you want to be very, very careful. And so I can feel them here. So these muscles are coming up like this. So if you just gently fan your way across to feel these tight fibers. So in a massage, you can go up and down through like this. You'll feel those transverse processes. And you can just gently work. And then, again, this isn't one of those ones where they can be really, really sensitive. And a bit like the sternocleidomastoid, they're not generally pain right there. But then when you hit them, they feel the pain. So don't forget scalenes with the pain between the shoulder blades. Fan your way through. And don't forget to work right down to the clavicle here. So feel a tight fiber there. As I say, these are delicate. You've got to go very gently and get your feedback from your client. Make sure they're okay with it all, checking their face at all times. So you want to do that, and then you come round. Is that okay, Liam? Yep. So you come round to those anterior portions. Oh, sorry, I felt that. I just felt that right then, right there, isn't it? Right there. So they're tight bands right there. And that is with trigger points you can get with what's called, it's actually called a jump response when you hit on one of these really tender trigger points. So, as I say, in your normal massage, which I showed you earlier on, you do that, and then when you want to do, if your client had pain between the shoulder blades, pain down the arm, front of the arm, look at your referral zones, and then you absolutely, remember, a lot of people miss these scalenes, or not so much miss, they just don't even think about them. So, yeah, if you when you start working on someone, you can feel these tight bands. So, as I say, please go gently as you work there. So remember, it's posterior to the sternocleidomastoid here. Just lift your head up again, love, please. Lift this part. There you go, thanks. So posterior to here, thank you, darling. So you can see that right through there. And you've got your trapezius here. So it's in that area right through, so triangular area. And as I say, don't forget to come to these attachment sites right down by the clavicle, because they can be anywhere along here. So just gently doing some presses on there. I can feel them in through here. So we've got plenty of work. So, all right, so there's your scalenes. Okay, so supraspinatus. It's in the supraspinous fossa. So you've got your spine of the scapula along here, and it's above it, deep to the upper trapezius fibers. Okay, so we've got a superior angle of the scapula here, with the levator scapula going up there, and you're just going to be above this spine and in here. Now, supraspinatus is, now you use from various angles. There's trigger points in here, which I can feel. So the fibers are going along here. They go under this iliochromium here, okay, and come out here. It elevates the arm out to the side. Very, very commonly involved. It's the most common muscle involved with impingement syndrome, painful arc syndrome. And so these muscles here, they can refer pain up through here. And so what you want to do is go across them, feel for those tight bands like I've got right here. So I'm doing it from here, but I can also do it with my thumbs like that. So you're going to come in here, right in there. You can feel these bands here. And of course, my preferred method, why stand when you don't have to? And you can sit in here, and you may even be able to see that. You see that little twang there as the tight cables in here. So, right, so we've got between 1 and 2 trigger points in here that you want to address, especially for pain around here. And then if you come along, there's one deep in here, right at the V here. So the bone's here, and right deep in here. And also, when the tendon comes out here, and you want to get out here. And so this one, I've mentioned this in several of my courses, for shoulder pain. People have pain problems with impingement syndrome, pain lifting the arm up. You want to work this, and I've found that just doing a little bit of cross fiber friction on this tendon works absolute miracles for people. So of course you can press on it, and you can do a little bit of just lengthening along that tendon there as well. And of course you could do double thumbs, what have you. Okay. So, and of course this can produce pain right down the arm and the outside of the arm as well. Again, just look at your referral patterns and your conditions, which muscles are involved. So there you go. That is the supraspinatus. Okay, so we're going to work the rhomboids now. Very common area of pain, but remember, I told you if people have got pain here, maybe the rhomboids, could be others. It could be infraspinatus, could be the scalenes, we never know. Okay, could be levator scapulae, there's other culprits around. And of course, remember we worked that lower trapezius here, and that can refer pain up through here as well, that trigger point down here where I showed you earlier. Okay, anyway, but back to the rhomboids. So, you want to go to these attachments through here, and the fibers run along this way, deep to the trapezius. Okay, so once again, you could now don't overwork these. I think, and no, I'm guilty of this myself. I think as massage therapists, we really want to, and yes, it feels good, but we don't want to make people sore. And I think I used to do that too much. So, by doing all the rest of the stuff, the fascia, everything that's interconnected here, these will relax. They don't. They can be like part of the problem, but not the main culprit. So once you've loosened up all the rest of the fascia through here, it releases them, and like the pecs as well, because these get overly lengthened, and so trigger points because we've got the tight muscles in front of the shoulders there, bring the shoulders forward, which brings these shoulder blades out, and so these get overstretched and weak, and the muscles at the front, the pectorals, they become tight. So both have trigger points, but for different reasons. And the main culprit is the pecs bringing these around, which makes these overstretched and overworked, trying to contract back to keep the shoulder blades in position. Anyway, so going along the muscles to the attachments in the shoulder blade here. So you can see when I come here, if I just go over that again, that's it. There's your, down to T12, there's your lower portions of your trapezius. Right, anyway, so let's just keep working through. So we can work along here. Of course, bigger clients, so you can come along. This is where you can use forearms by all means on bigger clients. Just lean down, make sure it's comfortable. Okay, and I showed you lots through the back massage, so they've already been really well worked just through the back massage in itself. But of course, work them. You feel these knots through here, okay, as we go through. And of course, you can come up across them, which will give you, as you know by now, a better understanding of where those tight fibers are as you go perpendicular to them, and you can feel where there'll be tight bands like there, and you press down and there's a trigger point right there. And as you can see, Liam's tightening up because I'm doing too deep work, so I have to back it off. Okay, there's your rhomboids. Spinatus here, right on our shoulder blade here. So I showed you in the back massage, I did work through here, gave it a really good workout. We used forearms and with my hand down so I don't clunk over this medial border of the scapula. If I did that, the ulna would go clunk, so unless you lift up over it, but it's much nicer to do that. If you wanted to, you could just hand down, and then as you come up onto it, then if you had a big client, you could put your hand like this to bring in the ulna, okay? All right, so we did that. Now, we've got trigger points here. The infraspinatus there's a trigger point in here. So we've got several trigger points throughout this muscle here, and one's close to this border can give pain back in here, the rhomboid area, just like your scalenes can, your rhomboids can. So, and you'll feel this is a very sort of ropey muscle, and we've got this top portion just underneath the scapular spine, the fibers go across here, and then as you see, these ones come up here, okay? And then you've got teres minor and major coming through here. But so for the moment, I can feel it right here. There's a tight band here. as you want to work here. Now, I'm working from the opposite side. You can do this no problems at all. But I could also do it from the other side, which I'll show you in a second. But if you just feel your way across on this tight band of muscle here, there it is there. That's the trigger point there. No doubt about it. Now, this is very commonly involved, this one out here in front of the shoulder pain. Okay, so this trigger point out around here, there, can refer pain. So don't miss it. If someone comes in thinking they've got bicipital tendonitis, don't miss this at all. Okay? And we've got ones down through here. So that's doing it from the opposite side. Of course, you could do thumb, double thumbs, depending on the size of your client, right? I don't need much pressure on Liam, but yes, you could do that. Yes, you could use your soft fists, warm up, fingers. So I'll come around the other side. All right, so of course you can work it through here, and so there's that one. You can feel it so obvious right there. Just sit on that one, and then here's this band here. All right, and there's a trigger point and there. Okay, so don't forget, out here, someone's got shoulder pain in front of the shoulder, you're going to give this extra love. All right. Now, if they go, "Ooh, that's reproducing my shoulder," what do? You say, "Okay, well, obviously going to give that more work," and you get them to use a tennis ball at home, of course, on that point. So you can just see that. Now, if you wanted to, bring the arm out and work it even more. And this is an external rotator. You see that? So lots of good work. Of course, you could use your forearms, but we want to do, I would finish with the forearms if you're doing a lot of work on this. And of course, you can bring the arm right up as long as it's not uncomfortable with the shoulder. And now you got it lengthened out. So this one's still like this, but this one here, as I said to you, they come up at a 45-degree angle. Now they're much more lengthened state. Oof, feel that right there. Okay, that will do. So that is how you treat the trigger points in the infraspinatus. Very easy to find those cables, those tight muscles, and trigger points in that muscle. You look at your anatomy here. So we had our infraspinatus going up through here, and then we've got the teres minor coming out, and you feel that there, and there's a trigger point, and this produces pain right at the back of the shoulder here, okay? So what you can do on the lateral border, you can come up and feel it there, okay? So you feel that ropey band, there it is there, I can feel it right there. Whoop, and you might even see that there, so twang that a little bit. Okay, so that is your teres minor, pain at the back of the posterior shoulder pain. And what you can do, what I would do is this. Start off, you okay with that, Liam? Yep. So someone's got pain at the back of the shoulder. Start off with this. So just on that lateral border of the lateral edge of the scapula here. Again, look at your anatomy if you don't know exactly where it is, but you can feel it there. You rope it, and so then we're going to put it on a little bit. Now this is an external rotator, okay? So you can get the person to externally rotate. Just bring your arm up like that, Liam, please. Honey? Liam. 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 Wake up. Push against my hand. Push against my hand. Push against my hand. That's it. So you can feel that pop up there. okay, when you get the person to externally rotate, doing this movement. Right, so anyway, my son's falling asleep here. So what I'm doing here, I'm working that, it was in a shortened position here, and now we're just putting in a little bit more length until we get right up here, and we can work it. Now this will be sensitive, so you've got to be, and there it is there. I can feel it right there. So just go gently. These muscles all around here can be very, very sensitive. But yeah, there is your teres minor. Okay, and then just gently lift it out and just relax your pal. And you can get in like that. You've got to go really, really gently with this. So I'm pulling that towards me to get in there. And this is one of those ones that can be really sensitive. And so that's one way you can get in there and just work along those fibers in there. Another way is, you just, and this is the preferred way, is, for me anyway, is to just work there. So what you're doing, you're coming between the rib cage, say it's being very sensitive, between the rib cage, and you're going in there, and you're going to work to feel those tight fibers in there. Which I can feel right now. So you're going down onto that anterior portion of the shoulder blade. So I've pulled it out like that, and we're going to work down and just feel your way through that. This is, say, one of those ones that can be really, really sensitive on people. So you've got to be really gentle on this. But you can just gently, and I can feel them right there. Okay, and you can also put a little bit of traction to bring it out even further. And so I'm just bringing that arm out there, which brings that shoulder blade out further. And I hope you can see that. Okay, I'll put my arm like that. So we're working there, and just work your way right along that shoulder. Okay, I can feel them right there as well. So you can do circles, you can go up and down like this. You're just pressing in as you work all of those subscapularis trigger points. Okay, so we're going to look at the teres major and lat dorsi together. Okay, they pull the arms down, as you know, like in a lat pull down. So the teres major is just right, it attaches at the very bottom. Look at your anatomy, and then they come out here. So what you can do, you can sort of pick them up. Just take this arm out a little bit. Okay, so you can pick these up here right at in the axilla here. Now you can sort of massage them like this in sort of a pincer grip. Okay, just work them gently, and you really were kind of working them together. So you can feel, because they're very, very close together. And so you should be able to feel them. As if I got them on both of them now, I mean, you can feel like both of them, one posterior to the other, or anterior, I guess here. Well, posterior or anterior, depending on which way you're looking. And you can feel the difference in here to the others. So it feels like a roll of fat, but that's these muscles here, and then you just feel them. Liam, just push against my hand, please. That's it. So you can feel them pop up, okay? So so he's pushing that way, and you can feel them, and relax now, pal. And you can feel them pop up. So if you're not sure, if you think, oh, this is just a roll of fat, you'll feel them if they push again, please. That's it. And you can feel them, you can actually see them coming up, and relax. And that's how you can feel them as well if you're not quite sure. And you'll feel them all through there. Okay, so for the deltoids, we've got your anterior, so at the front here. Now, remember the deltoids have got trigger points in the anterior portion, the lateral side, or what they call the mid portion. And these are most commonly in here because this is where the deltoid, in abduction, does most of the work, lifting holding your arms out to the sides, typing at a keyboard, this sort of thing. So you'll work these face up and face down. Well, obviously these ones you work face up, supine, and the posterior portion with them prone. So, as I say, most of the trigger points are in here, and what you want to know is when the shoulder's got pain on movement, as opposed to someone's just got an ache, like supraspinatus achy, that kind of thing. Deltoids are like generally on movement is when the pain is felt, as opposed to, they're just standing there and it's aching. That's not normally deltoid. And these trigger points refer pain basically where they are. So if there's pain around here, that's generally where the trigger points are, if these are the trigger points that are involved. So you can just work through here. Of course, I'm just using fingers for Liam, but of course you can use fist, depending on the size of your person, your client, and of course using really nice myofascial release work with your forearm. And you can see I've got my hand down here, so I'm using the forearm extensions as opposed to the bone because there's not much going on here as far as muscle bulk. And again, that would depend on your client. So just give it a nice stretch. Just a little bit of the biceps here because it's all fascial connections. As you can see there. You could even come around, see this, just using the back here, and do the mid portion. Now, of course, you could bring it over here, just give you a bit better access. As we work through. And of course, if there was pain at the back of the shoulder, you'd have them prone and you would do exactly the same thing, just working through the posterior deltoid if there were suspected trigger points for the posterior pain. Okay, so the biceps trigger points. Right. Well, this is an easy one to remember. You've got biceps, two muscles, two heads. So you've got one going up here, the lateral one, coming up. It's called the long head, comes up into here, actually goes into the shoulder joint. And the second one, the more medial one, comes up around here. Okay, short head of the biceps. Right. The trigger points are in the middle of the belly of the muscle here, and they both refer pain, so it's an easy one to remember, refer pain up into around the biceps tendon. It's very commonly diagnosed as bicipital tendonitis, but it can be just from the trigger points through here. So what I like to do, so you can use double thumbs, but we'll just warm up this muscle a little bit. So if a person had pain at the front of the shoulder up here, so we'll do our usual soft fists. Now, what you'll see me doing, as I did in the supine massage sequence, you see I started off in the contracted form, and then as I go up, we get this nice shearing. It's called shearing. So really nice as we extend the elbow, which lengthens the muscle. You do it the other way. You don't have to do this, but you can get nice work done with it when it's not on a stretch. You get to deeper fibers. Okay, so we're going to go for these trigger points. You go along here, look for those tight bands. Right here. And there we are there. If you look right there. So again, you could, again, if you need to, double thumbs, just go gently. I don't need to. Again, depending on the size of your client's biceps, the size of the person. So just remember, they're right in the belly of the muscle. Look at your charts. And then there's the other one. The only thing you've got to be careful here, you've got big nerve bundles through here. So you definitely, you know, the funny bone, this sort of thing, you definitely don't want to come too medial and start going on here. You twang that nerve, the person will jump. It's really uncomfortable. So just be careful when you're doing this medial head. All right, so remember, feel, start scanning for tight bands. And then again, if you want to get feedback from your client, or if you can feel where they are, and I can feel one right there. In fact, you see a little muscle twitch right there. Okay? So just remember, when you're doing this, you can start off with it in a contracted space, so nice and relaxed. And then you can work it, give you a nice myofascial stretch once you're on them. There's this medial one. There we are. And if I just work that. Okay. There's your biceps. Really easy. Remember, they're in the belly of the muscle, both sides, and they radiate up here.